Hi, I'm Dr. Som, a board-certified plastic and reconstructive surgeon, and today we're going to talk about earlobe reconstruction. So earlobes are very commonly damaged from earrings, whether it's from earrings that end up pulling through or from gauging, where you end up with very large holes in the ear. Patients come in for reconstruction very commonly. So what do? It's a very simple outpatient procedure. We typically do it in the office without the need for any kind of general anesthesia, under direct local anesthesia that's injected in the area. In about 15 to 20 minutes, we can do each earlobe. What does this involve? Depending on the earlobe and what's going on, for example, let's say they have some gauging problems. What we need to actually do is remove this involved area and close this back up. So it involves excising that area and then putting in sutures to close it up. So in some extreme cases where the gauging is really, really large, it may cause a significant reduction in the size of the earlobe. But in most cases, for example, where it's just from an earring that's torn through, it's a much smaller excision that's required, with very minimal outcomes being different than their normal standard ear. Most people do it bilaterally, so both ears are done, so there will be symmetry, which is the most important thing. If it was one ear and the other was significantly different, that's where it starts to become very obvious. But if you're interested or a loved one is interested, please feel free to contact us, whether it's via email or in person. We're here for you.